can accompany, I will remind, many diseases. And now we'll try to consider every complaint in more details. Because characteristics of to know what patient has cough or dyspnea or some other complaints, it is not enough. It is important to know characteristics. So we should ask a future patient about this in more details, because according to characteristics of some of complaints, you can suspect diseases. At first, it is cough. Cough, we know, it is a protective adaptive reaction to clean our respiratory tract, our tracheobronchial tree from different irritating agents. It may be some foreign bodies, it may be different types of irritants like this. And cough, the understandable, has not only like positive moments. It is not only to clean our airways, and unfortunately can lead to emphysema or lung emphysema. Don't mix with subcutaneous emphysema, yes. And in strong cough can lead to rupture of mucosa and future hemoptysis, or can lead to rupture of the lung tissue, like this. It is serious complications. So, who has what is the what are the mechanisms of the cough appearance? I will remind you anatomy. Of course, we have some coughing receptors what are located in nasopharynx, like upper airways, trachea, bifurcation of trachea, big bronchus, and there's no coughing receptors in lung parenchyma at all. We don't have coughing receptors in the terminal parts like distal bronchi, only in beak, and plus we have coughing receptors in pleura. So one of the mechanisms of the cough appearance is irritation of coughing receptors. How? We said before, it is this adaptive reaction to clean airways. So it may be different types of irritants: mechanical, thermal, chemical irritants. If it is mechanical, there's some foreign bodies, some dust, what will pass into airways. If thermal, different air, it may be cold, maybe hot air, and chemical irritants, it may be like smoke, or something else, some chemical substances what can pass into the airways. So it is one of the mechanisms. So it is irritation of coughing receptors, and cough can accompany many respiratory problems. That you can see, it may be infectious disease, allergic reactions. It may be not only this. We have violation of pulmonary circulation, and like I said that before, we have coughing receptors in the pleura. So inflammation of pleura, pleurisy, it may be dry oxidative, can cause cough appearance. And not only, we have some vagal stimulation. So pressure on the nervous vagus can cause cough appearance too. As a rule, it is compression by enlarged lymph nodes, like level of trachea, bronchi, like this. So it is not all causes of the cough appearance. Maybe you heard what some cardiovascular diseases that can lead due to congestion of blood. No, it is a violation of pulmonary circulation. That is due to congestion of blood in the circulation. It may be congestive heart failure, it may be mitral stenosis, and maybe patient can have cough, due to some GI tract problems, because maybe you heard about reflux esophagitis, when the stomach contents can pass into airways, especially during the night when we have lying position, when the sphincter is open. So it is possible not only cough appearance, in some situations it may be suffocation really. So do you see how many diseases can, not only respiratory problems, can lead to cough appearance? And according to classification, now we can classify cough into different types. different what kind. No, at first, like dry and productive cough, or we can tell like non-productive, productive cough, how you wish. But non-productive, I think it may be like both absolutely dry without sputum expectoration, like in case of the affection superior, it is impossible to have any sputum. Or in case of the bronchial asthma, for example, as an allergic disease, patient can expectorate a little bit, but it should be many coughing movements until expectoration of small amount of like sticky or thick sputum. Productive cough means it is until expectoration of the sputum, sometimes enough 2-3 coughing movements to expectorate sputum, and many diseases accompanied by productive cough. Lung abscess, because we have cavity, this is cavity that pass, bronchiectasis, because we have like reservoir for sputum, like accumulation, COPD, pneumonia, but and bronchitis not maybe initial stage, not only onset. I'm about bronchitis and pneumonia, but later on the height of this, we have sputum expectoration like this. After that, cough can appear in different time of the day. Somebody can have morning, evening, night cough, or it may be like persistent or like permanent, like this. You can see here examples of some diseases. As example, morning cough. It is typical for some chronic disorders. If it is bronchitis, no, smoker's bronchitis, when we have some cavities in the lung, if it is abscess, gangrene, maybe some tuberculosis with cavern formation, and also bronchiectasis. Why? In this case, we have morning cough. And what is morning? Because I think, according to your experience, you know, many people, when we get flu, cold, then we have usually cough. And it is maybe different. Sometimes night, sometimes morning cough like this. If you have night cough, but you can see here it is like serious health problems that can cause night cough, like tuberculosis or some tumor. I think you had night cough, but you didn't think about something serious. I am about what? Morning cough. So patient can have cough during the day maybe, but morning means we'll expectorate more sputum in the morning. Cough will be more intensive in the morning. So this anti-expectation, why like this? When we have reservoirs for sputum, during the night, we usually move little bit. We can move little bit, but after awakening, after wake up, we can move and I think our cilia together will move some sputum to reflexogenic zones. So you know it is a big part of the big bronchus, trachea. So when will be moved where it will retain receptors, patient will experience sputum. Here. In some situations, in inflammation of upper respiratory tract, patient can have morning cough, but it is usually dry. About evening, here written about evening, but you can see both patients with bronchitis can have morning or evening cough, so it may be this increasing in the morning time or evening time. Or you can meet like patients with pneumonia, mitral stenosis can have evening cough, but evening cough, I worked in pulmonary department, there are many patients with pneumonia had night cough really, but night cough here written something serious. If you will have maybe night cough, don't think about something dangerous, serious. No, I don't know about serious, something dangerous. At first, analyze your symptoms. According to one symptom, according to one sign, impossible to estimate disease. We can suspect something, but now we have so many diseases with atypical duration, unfortunately. So it is only examples of diseases. I think you understood it. After that, you can see here persistent cough. Now it may be again the inflammation of upper airways, or if it is pulmonary tuberculosis, it is usually I think if it is pleurisy due to pulmonary tuberculosis and due to other forms like this. So I will repeat, it is only examples of diseases like this. We have another classification of the cough according to rhythm. Is important, I think, especially who has paroxysmal cough. Paroxysmal, what can come as attack, like fit-like cough, when it is possible, when something foreign will pass into the airways. We have paroxysmal cough. I think you heard about bronchial asthma, COPD. So attack of bronchial asthma, it is accompanied by paroxysmal cough, and maybe also just very severe strong cough, whooping cough, like this. What does it mean? What does it mean? Lung and bronchial cough. So we can compare this. I think productive cough, because it is until expectoration of sputum, lung and bronchial. And I gave you 4 examples of disease. If you wish, maybe pneumonia, maybe abscess, bronchiectasis, like this. And hacking cough, like in the form of separate cough, it is not, for me. It is like dry. I think mostly dry cough. It is typical for some upper airways inflammation, like you can see here, tuberculosis, like this. Timbre of the cough, I think our voice timbre depends on function of the vocal slits, and here inflammation of vocal cords, some ulcerations, inflammation or swelling of false vocal cords can change cough timbre. How? Oh, about I have a good sense of the humor. For example, about barking cough, we have different types of the dogs, and with high pitched and low pitched sound also. It is if it is low pitched, like barking. Barking cough is typical, so typical for like whooping cough. That is barking really, and due to compression of the trachea by the tumor void, that may be, or in case of the whooping, it is swelling of the false vocal cords. Husky, it is like dry, dry, but it is specific timbre. I cannot explain now what is this, but barking, you know, about dogs. Short and careful. What is this? I don't know, it is temper of the cough emerging if somebody has pleurisy, inflammation of the pleura. I will explain later. Pleura contains pain receptors, so only due to affection of pleura, patient can feel pain. This pain is a sharp pain, and usually increases during the deep breathing coughing. So we know cough can increase pain. In this case, patient try to restrict like chest, and it will be like short and careful cough, like this. And about silent, when we have again like inflammation, ulcerations of the vocal cords, or if it is edema or severe patient's weakness, it can cause like silent, like without any sounds, like this. After that, about some terms. When we can have cough, I think it is not like meal until, no, for me, until vomiting, until vomiting. So it may be due to, or cough like with vomiting, or until vomiting. The coughing center and vomit center like nearby in the brain. So overexcitation of coughing the center can cause vomiting. So it will be understandable. That is cough with meal. When we have very severe cough, whooping is paroxysmal, strong cough. It may be due to cancer of esophagus. In this case, we have some admixtures of food. There is difference. It is cough until vomiting, or if sputum contains like food. In this case, when we have connection within this like esophagus and trachea, in this case the food can pass into airways like this. After that, by full mouth, usually we have small amount of sputum expectoration, but in some situations, in some diseases, typical it is we have, I think, like one disease. It is abscess of the lung. It is formation of the cavity. If it is big cavity, this pass. So after opening, and in future we'll study, we have two stages, like two periods of lung abscess: before opening, after opening. But after opening, patient will experience sputum by full mouth, so it is a lot of the sputum. About vomiting, I have already said. Okay, it is different. Vomiting and meal. And sometimes when the patient will change position, the cough will be increased. When? Do you remember we studied some forced postures on the affected side? Here the same examples: abscess, bronchiectasis, because on the affected side, when the patient will assume position on the affected side, the contents of the cavity will inside the cavity. When the patient will change position to another, the contents will flow to healthy parts of the lungs, will cause irritation of the cough receptors. Cough will be increased. I think you remember we have special postural positions, like postural postures, for removing of the some cavities contents like this. Well, this cough with some position like this. And I said that before, the cough may be dry or non-productive, if you wish, or maybe the sputum expectoration. And sputum, it is a pathological secret, because healthy persons don't expectorate any sputum, you know. And any sputum has many characteristics. What kind? At first, it is character for me. Character of the sputum are different in character. Sputum has different characteristics. I will show later. It may be color, amount, consistency, certain smell, presence of some admixtures, like this. And according to character, we have what types of sputum? We have mucus, serous, purulent, and the combination, it is mucopurulent. And let's give characteristics for every type of the sputum. If to take serous sputum usually, we have some character, and here you can see characteristics. It is liquid in consistency, just transparent usually, foamy, and this type of the sputum typical only for one health problem. It is pulmonary edema, and maybe not only transparent, maybe can have pink color, like due to deposits of erythrocytes into the alveoli, like this. So it is liquid, sometimes transparent, sometimes pink in color, foamy, foamy. So it is only typical for pulmonary edema. Serous sputum. After that, mucus. We have many diseases which accompanied by extraction of mucus sputum. Now it is asthma, bronchitis, I think initial or onset of pneumonia, but it depends on pneumonia, what kind of a sputum patient would expectorate. So usually mucus, and only serous sputum is liquid according to consistency. Other types like viscose. So, and mucus, it is viscose in consistency, usually colorless, can have white color. No, if I cannot tell, I think what is transparent. Transparent, it is serous sputum. Here, white color can have. Sometimes transparent, but not so little bit cloudy, I think. And mucus sputum usually doesn't have any smell, so odorless, and we have usually small amount like this. After that, about purulent, direction of purulent sputum is typical for what diseases? Destruction of lung tissue like abscess, gangrene, bronchiectasis. In some situations, maybe bronchitis, but it depends on type of bronchitis, like this. So, what are the characteristics of the sputum if it is purulent? Color may be different, sometimes yellow, maybe greenish, grayish, in color may be rare combination, usually thick in consistency. About amount, we have different amount, but a lot, if so, or patient can expectorate sputum by full mouth if it is a lung abscess. I have already explained that before. So, what you should know, the sputum usually, as a rule, odorless. We have only some diseases, some conditions which accompanied by very bad, like fetid, putrid odor from the sputum. It is in case of destruction of the lung tissue. What? Again, it is abscess, gangrene of the lung. No, you can see one more here written about bronchiectasis. But according to my experience, I had in my experience patients with a lung abscess, and it is really bad smell not only from the sputum, from the patient. We cannot breathe near the patient like this. It is so bad smell. You can differentiate it from anybody like this. So it is really bad, like fetid odor. If it is sputum, purulent sputum, what is typical for lung abscess after staying on in the some, I don't know, flask, it can be divided into like three layers. Upper layer is serous or mucous-serous sputum. After that, middle it is mucus, and lower layer it is purulent sputum. It is important things. And mucopurulent, it is like combination. Mucus or bronchitis, sometimes pneumonia, and bronchopneumonia, we can have this type. So it is combination. About color, I think I have already explained, but here, in addition, when black, that I didn't say, we have some occupational pathology. It is the pneumoconiosis like anthracosis or siderosis. It is after exposure of the coal dust. So our coal, according to color, is black. So we can have black color. So, and in case of the but I think I will explain later when we'll explain hemoptysis, because in some situations, if it is lobar pneumonia, patient can have rusty, this like rusty in color sputum, or here you can see like color raspberry jelly in case of neoplasma, like this. About odor, I have already said. Let me skip. Next, the sputum can contain different admixtures. What kind? The some you can see, I think, by vision, by macroscopic examination of the sputum. Some admixtures, I think, only by microscope. So if it is particles of tumor, I think it is only by microscope can be seen like this. Food particles really, we said that before, it is like off with meal when we have like connection, fistula between esophagus and trachea, or it may be I had patients with tracheostoma, and during the eating, the food like passed into the airways, and he had sputum with like food, because small particles can be excretorated, so it is due to this. So it should be connection, or in bronchitis or tracheostomy, maybe too. About foreign bodies, I think it is understandable that when can cause it. Admixture of the blood, about hemoptysis, I will explain. And parasites, you know, the cycles of some parasites will be inside the lung. It includes not only presence of the parasites inside the sputum, and it can cause hemoptysis too. So hemoptysis, what is hemoptysis? I said before, it is the presence of the blood in the sputum. What are the main mechanisms of appearance? It is destruction of the lung tissue, and it is increased permeability of vessels. When it is possible, we have many diseases which are accompanied by sputum expiration with blood, by hemoptysis. At first, we have some diseases which are coming by destruction of lung tissue. I said before, it may be lung abscess, it is gangrene, it may be but pneumonia. It is not with destruction, but it is some infectious pneumonia. If it is lobar pneumonia, rust in color. Tuberculosis, I think you heard about this. Bronchitis, because there's some destruction, but not lung tissue. There's bronchi destruction. And when we usually see emerging, if you will see blood in the sputum, at first we think about something bad. What? About cancer. Oh, it is so typical for bronchogenic carcinoma. At first, my first thinking that we have typical causes of the hemoptysis. Like my first thinking will be about some cancer, tuberculosis, pneumonia, and also some other diseases can be accompanied by hemoptysis. When it may be cardiovascular problems, because maybe you heard about pulmonary embolism. Pulmonary embolism, so patient will extract sputum with blood, maybe mitral stenosis. That patient will have Ebbinghaus plus presence of the blood in the sputum. Pulmonary edema, we have already considered the pink color of the sputum, like this. And we have, I said about parasites, it can cause hemoptysis too. And maybe we have many other reasons. It may be iatrogenic, like you can see during some diagnostic procedures. It's possible to injury some mucosa of the tracheobronchial tree, like during the bronchoscopy, for example. That's so it is, and it may be some traumas, it may be some vascular disorders, because one of the mechanisms I said it is increased permeability of vessels. So many, and what you should know. Sometimes it is possible to differentiate, because some patients cannot understand what is the source of the bleeding. Is it respiratory tract or maybe GI tract? So for somebody it is clear. For somebody we need to differentiate. I had in my experience the patient who couldn't understand what is the source of the bleeding, and I sent him to different stomatologists, because initially he said I have gingiva problems, it probably it is bleeding from the oral cavity, like this. So we need to differentiate. It is very easy, I think, but there is difference. Hemoptysis and pulmonary hemorrhage. I think amount of extracted blood is different, not expectorated, that blood, because the hemoptysis means you can see blood in form of the streaks. It may be clots, or maybe blood can be mixed with sputum. So in this case, if it is pulmonary hemorrhage, we have bright red color sputum, usually contains air bubbles, like this. So, and it is mixed with sputum, like this. So, to differentiate hemoptysis, or if you want pulmonary hemorrhage, and hematemesis vomiting the blood, it is sign of bleeding from upper part of gastrointestinal tract. But some situations we need to differentiate. it is understandable if hemoptysis patient usually expectorated during the after coughing, and hematemesis is vomiting the blood. So just blood, what you can see like together with vomiting. About color, I have already said about color of the sputum. If it is pulmonary hemorrhage, that's bright red without other variants. About bleeding from upper part of GI tract, we have coffee ground color of the sputum, or sputum, sorry, sputum in other case. So we have coffee ground color of the vomit due to like a digestion of blood by the gastric juice, that is due to interaction with hematine. So coffee ground usually